So I'm often asked, what is the difference between a bonded or composite veneer and a porcelain veneer? There's a lot of interest in composite veneers at the moment, especially if you look on Instagram. And the huge advantage of them is that it tends to be done less invasively with less reduction of the tooth than a traditional porcelain veneer. So the main difference between them is that one is made of a composite resin, often known as bonding, and porcelain is made from a ceramic or glass type material, i.e. porcelain. And there are great differences between how they function and how they look, but in effect, they are used to try and create the same kind of solution. Why would you need a veneer? Veneers are done for many reasons. Usually people who are very unhappy with the appearance of their teeth, particularly the size of their teeth or the color of their teeth, and sometimes the position or the crowding of their teeth leads them to come in and ask for a veneer solution. But in general, they're used to make a tooth that's either too small, too narrow, very worn, or very discolored look like a much more perfect tooth. So it's used in patients who have worn their teeth down, in patients who are missing teeth and want to make it look like that missing tooth is back in place. And it can also be used to make narrow or small teeth look fuller, look more beautiful, and to make the smile much more perfect. So in general, veneering is done to make the smile as perfect as possible. So depending on the type of veneer, there are differences in the advantages and disadvantages. Composite bonding or composite veneers, in general, but not always, tend to be less invasive. They tend to be done without any or with very, very minimal tooth reduction. And so they have an advantage over porcelain veneers in the sense that in porcelain, we often have to do some tooth reduction, not always, but often we have to do a little bit more than if we were replacing composite veneers. So there are advantages and disadvantages depending on the material that is used to make the veneer. There is a difference in the cost of the material. So composite is much cheaper than porcelain, but composite has disadvantages in the sense that it picks up staining, it discolors faster, and the surface loses its shine and its luster. So if you wanted to have a more perfect result that lasted longer, you would tend to choose porcelain. But if you wanted to be very less invasive and you wanted an option that was maybe more cost effective, then composite bonding may be the choice. But each solution has its relative advantages and disadvantages. So depending on the type of veneer chosen, whether it's porcelain or whether it's a composite veneer, again, sometimes known as bonding, they are fitted in different ways. Porcelain has to be made by a ceramicist, so a master craftsman who makes the porcelain veneer in a laboratory, and that usually takes between 1 and 2 weeks to be crafted by hand and to be delivered to the dentist and for the dentist to glue them on your teeth. So the process takes longer. And invariably what happens is between tooth preparation and the ordering of the veneers from an impression, the patient wears temporary versions or a prototype of the final result for that period, say 1 to 2 weeks. On the day they're fitted, the temporary teeth are removed, the teeth are cleaned thoroughly, and a special bonding or gluing process is undertaken that makes an extremely tight microscopic bond of the porcelain to the tooth. Porcelain veneer fitting is much more involved, much more complicated than composite veneer or bonding, where bonding is often done by the dentist, either sculpted by hand using their own design ideas, chairside. So literally you come in for the bonding veneer and it's done on the same day. Or sometimes it's done from a design or a template and an injection mold or some kind of way of building up the composite is done. Either way, composite veneering is done usually in one sitting, in one appointment, with a follow-up appointment for fine polishing and adjusting. But porcelain veneers almost always take 2 appointments and almost always use a ceramist or a master craftsman who has to make those veneers for you first. So we're always asked, which is better, composite bonding or porcelain veneers? And the simple answer is there's no black or white answer. There's no yes or no, one is better than the other. It really depends on the patient's situation, the age of the patient, the budget the patient might have, the condition of the teeth that we're trying to change, the bite, etc., etc. In general, we tend to offer composite veneers or composite bonding to younger patients because invariably it involves removing less tooth structure and it's much less invasive and it's also much less costly. However, it does have to have disadvantages in the sense that it requires a lot of maintenance. It picks up staining and chipping over a relatively short period of time compared to porcelain. And so there's a lot more involved in keeping it looking fresh and looking perfect. Porcelain, on the other hand, never loses its luster. It looks the same as the day that it went in for many, many years and can sometimes last up to a decade or sometimes up to 15 years, maybe 20 years before replacement is required. So you get much better value for money over a long period of time with porcelain, but porcelain requires usually a little bit of enamel reduction, sometimes a lot of enamel reduction, and that's an irreversible process, something that we can't change. So once you've committed to porcelain veneers, that's a commitment to porcelain veneers for the rest of your life. With bonding, yes, it's less invasive, but it's still not 100% reversible, but it is more possible to bring the tooth back to how it was before treatment if the patient decided to do that. But either way, the answer depends on a lot of factors, and really it's a discussion, an important discussion with the dentist to decide what's the best solution for you, the patient. So if you have different types of veneers, then the advice about how to look after them is slightly different. The big difference between porcelain veneers and composite veneers or bonding is that the composite will stain. It's a porous material, whereas porcelain is like a glass, it's almost impenetrable. Therefore, you can eat and drink what you like with porcelain and it will not change color, and it's very difficult for it to chip or to break apart. Whereas composite will pick up staining. So for example, if you consume a lot of turmeric or spaghetti bolognese, or you drink a lot of Diet Coke, then your composite veneer or your composite bonding will not look so good after a few years. And it will begin to discolor almost immediately after it's placed. Maintaining them usually involves very regular hygiene visits where they can powder polish and spruce up the composite. Sometimes after a period of time, you have to go back to the dentist to have the surface redone, and that involves time and cost. And you can also continue to bleach the surface of composite veneers. So if you were bleaching your teeth, you can also bleach the composite veneer. Invariably, both of them involve you having to see a hygienist regularly. So if you have any artificial dentistry done, it's very important that you have regular hygiene and you go and have your teeth checked and cleaned on a frequent basis. But between the two, porcelain is much easier to manage. It's much easier to keep clean. Porcelain tends to be more compatible with the gums, more biocompatible, and therefore you're less prone to getting gum inflammation with porcelain than with composite. So the maintenance is slightly different, but the simple answer is go regularly back to your dentist, go regularly to see your hygienist 3 or 4 times a year, and keep them really nice and clean at home using ultrasonic or electric toothbrushes, and maybe occasionally bleaching your teeth if you have composite bonding.